Well, in a written reply to questions in the Gauteng legislature, the provincial MEC for Health, Nomantu Nkomo-Ralehoko, revealed that companies with links to Deputy President Paul Mashatile's sons have been paid millions to ensure that hospitals in the province are compliant with occupational health and safety measures. Now, in an investigative report, News 24 has revealed that an estimated 46.6 million has already gone to these companies, meant to service fire alarms and sprinkler systems. The Democratic Alliance is now looking for answers, and for more on this, we're joined by the party's spokesperson for health in Gauteng, Jack Bloom. Thanks very much for your time. I mean, the irony of the story is that there have been 2 fires this year at Tembisa Hospital.
Well, absolutely, and the companies are still claiming an additional 44 million rand because they're claiming for services the department says they're doing. I want to know what they are doing. They certainly didn't do anything at the Tembisa Hospital, and all of our 37 hospitals are non-compliant with occupational health and safety legislation. So, it looks very fishy indeed. And in fact, the original contract, which was given about 3 years ago, was for 49 million rand. Now the total claims of these companies is over 90 million rand. So, look, it's all very suspicious. And we need to know what exactly these companies have been doing with this enormous amount of money when our hospitals are still not fireproofed.
Yeah, I'm looking at the description of the money that's been paid, apparently for services rendered for 2022-23 and then 2024-25. And the only description that I can see here is services rendered by the service provider. Look, if you're getting paid tens of millions of rand, I'm going to need more of an explanation than that.
Well, that's what they told me in the official reply I got when I asked the question in the legislature. So, look, I'm going to do follow-up questions. I want to know which hospitals they supposedly did what they claimed to have done. And I want to know about Tembisa Hospital. I mean, not just one fire, but 2 fires with devastating effects because that hospital is still not fixed. Patients are still being diverted. It's very, very onerous for the community involved because they have to go to neighboring hospitals, which are actually quite far away, and they're already overcrowded. So, we can't have a fire risk in our hospitals. Patients are very vulnerable, staff, and the fact that we're paying out so much money to companies that don't appear to be doing their jobs, I think needs further investigation. And then, of course, they are linked in various ways to the 2 sons of our Deputy President. So I would hope for an expedite investigation and that we need the answers. But meanwhile, I am asking further questions, and hopefully we get extra information that, sheds more light on this.
Right. And part of the questions that we want answers is, did this go to tender? Were the companies vetted? All of the usual procurement questions that we ask when it's involving this amount of money.
Well, the strange thing is that we're told they were put onto panel providers. On a list of providers. Now, that's always been a very strange process to me because, either get a contract or you don't get a contract. And in each case, you should have a separate tender for it. So, yes, I'm going to be asking follow-up questions on that as well. And how does an original contract of 49 million rand become almost double that? Typically, I've seen this before where companies come in with, a low amount of money and then the contract keeps getting irregularly extended. We've seen this with the security companies for hospitals. The Auditor General points it out, and it's irregularly spent money, but meanwhile these companies benefit.
Jack, if indeed these companies are linked to the Deputy President Paul Mashatile's sons, that is something surely that would be flagged by the panel that appoints these contractors as a conflict of interest.
Well, that never seems to happen. We have umpteen cases of officials not actually declaring their interests, and I think in high-profile people, when they're involved in particular companies, there needs to be extra scrutiny because obviously people are going to be suspicious. The Gauteng Health Department is absolutely notorious for for corrupt contracts. We saw with the Tembisa hospital, SIU has uncovered more than 2 billion rand of fishy contracts and irregular spending. And Babita Deokaran was assassinated because she tried to stop this. So I would like to see much more tightening up of how contracts are awarded, and that, relatives of prominent political people, I think, should get extra scrutiny because, people are naturally suspicious. And in the case of Mr. Paul Mashatile, he's embroiled in lots of controversy with other contracts and things happening in the Gauteng provincial government as well.
The 2 billion rand that you talk about at Tembisa Hospital, that's one way of looking at it, Jack. Of course, the other way is to look at the past decade. And over the past 10 years, Gauteng Health has lost 20 billion rand to corruption. At this rate, our residents could have been using public health care that resembled private health care.
Well, yes, it amounts to about 2 billion rand a year, and I think it's an accurate estimate. It might even be an underestimate, because there's also further costs when you award contracts to companies that don't deliver. Then you have to re-award the contract and pay more money to get the same job done. So I actually think it's an underestimate. But just think that if we had that 20 billion rand. Well, we could have built extra hospitals, we could have filled all our staff vacancies, got decent equipment. The whole health experience in Gauteng's public hospitals and clinics could have been changed dramatically. So, people are stealing. Even during the height of the COVID-19 epidemic, 1.9 billion rand was specially made available to assist in that dire time, and just most of it was just plundered, actually. They wasted 500 million rand of that on an empty hospital now in the far West Rand. And we don't see the accountability for this. And that's why the DA has been calling for some time now for the current health MEC to be dismissed, as well as the current head of department, who actually is being investigated by the SIU for allegedly participating in multi-million rand bribes in connection with a tender. So I think that department needs a complete clean out, and we need to scrutinize other contracts, then do something about it.
Who knows how many lives could have been saved over that period. Jack Bloom is the DA's spokesperson for health in Gauteng.